could, kind of start with the basics, with what exactly you do, for anyone paying attention, for folks in the audience who might not know, can you kind of walk us through what your job looks like sort of day to day as a college and career readiness counselor?
Yeah, so my role is I'm the director of college and career readiness for Mount Diablo Unified School District. And so I kind of came into this position. I taught at Mount Diablo High School for 16 years in a California Career Partnership Academy. And these programs are grant funded through the state. And the idea of them is to the CTE class with the academic curriculum. And so I was not the CTE teacher. I was a history, so I taught U.S. history and government econ. But it was a small learning community. And so I taught in that program for 16 years and really kind of built it up with my teaching partner. And so then when he left, I kind of was like in this, identity crisis because I was kind of hitting the point where teaching wasn't as much fun for me. So I started to think about what are other things that I really wanted to do, and developing an exit strategy. So then I became a vice principal for 1 year, which I absolutely hated. And so then grant funding from the state started to come down to support the development of career pathways in school districts. So we were part of a regional grant called California Career Pathways Trust Grant. And they needed someone at our district office to kind of manage that grant and to support our career pathways. And so that was 9 years ago. I came into that position. And in that 9 years, the state has kind of provided a bunch of funding to support the development of career pathways, the development of early college credit that are tied to career pathways. And so I really, over the course of the year or the years, we've gotten more and more grant funding. So I've been able to really kind of build a department within our district. And so that's kind of where the college and career readiness department grew from, is all the grant funding that we've received from the state. And so now I have a team of people that work to support all of our career pathways. We've got at least 2 career pathways at our 5 comprehensive high schools, and then we're building a career pathway at one of our alternative ed schools. And then I also oversee all of the early college credit opportunities in our partnership with Diablo Valley College. So that includes classes that are articulated where there's a high school instructor and they get credit by exam, to dual enrollment, which is where a college instructor teaches high school students. And so I oversee our College Now program, which is like a small alternative high school program that's on DVC's campus. So I kind of wear multiple hats in the district. And then as my position has grown, I've expanded. So as we look into the future, I support our college and career advisors. They're the ones that work at the high schools, and they support all of the students in applying for college and doing some career exploration. And then I'll be working with our site counselors in the implementation of the new platform that California Department of Education is sponsoring, called California Colleges Guidance Initiative, or CCGI. And that's a platform that schools can use to support college and career exploration. They can launch all of their UC and CSU applications through this platform, so it makes it much easier to apply to college, and then their financial aid applications, whether it be FAFSA or CADA. So I'm working to support the implementation of that platform across the district. And what's cool about that platform is it's a 6 through 12. So we can start doing career exploration at an earlier age as opposed to waiting until they get to high school. So that kind of in a nutshell gives you a little bit of a glimpse into the things that I oversee for the district.
And what exactly are your credentials we're talking about education, and you enter this with some alphabet behind your name. What are your credentials that have you in this position?
My father would say I have too much of an alphabet behind my name. So I graduated from Davis with a degree in history. And as many students who graduate from college and have no idea what they're going to do, I ended up going to law school and getting my law degree and practicing, and then I practiced law for 6 years. But really, I went to law school because I had no idea what else to do. I was passionate about, and still am, civil rights. I love learning about the Constitution, and I love, whenever the Supreme Court issues a ruling, I love learning about it and reading it. But once I got into the actual practice of law, it was very clear to me that that wasn't going to fulfill me in terms of my passion. And so then the opportunity to teach at Mount Diablo High School kind of came through, ironically, a golf game. I met the principal of Mount Diablo High School when I was out golfing with my college roommate and her husband. And I met the principal that way, and we started talking, and he said, "Oh, I have a position, come in and talk to me." So I made an appointment. I went in and talked to him, and he said, "I can't hire you now because I hadn't taken the CBEST. I wasn't signed up for a teaching credential program." He said, "Get your ducks in a row, essentially, and then I'll keep you in mind." And so that was like in March, and then the following August, I was working at my law firm. I get a call from the principal. He says, "I told you I wouldn't forget about you, and I have a job for you." And so I went and I did that. And after teaching for, I want to say 14 years, we had a principal come in that I really just didn't like. And so it became clear I needed to start thinking about kind of my exit strategy. And so I went on and got my educational doctorate in organizational leadership. And so what that allowed me to do is start to really think larger picture about how education can play in a role in multiple issues, not just teaching. And then I took the test rather than go back to school and get an administrative credential. They have a test you can take. So I took the test instead of and that gave me my administrative credential. So I think I'm done with education. I don't think I need any more initials behind my name. I love to learn, but I think I'm done in that world.
So it seems like this phrase, college pathways, career pathways, college and career readiness, it can mean different things in different places. You yourself just went through an example of exploring different career pathways, but I'm curious, how can you define it in the work that you do, whether it's the phrase career pathway or the phrase college and career readiness?
I almost feel like we have to change the way we think about it and think about in terms of life preparation.
Okay.
I think that the problem that we've had for too long is the emphasis is on college. And for many students, especially students who would be first-time college students, or they're just not, school's just not their thing, or they've got special needs or what have you, when we approach conversations with college as the end all to be all, we're essentially saying then that you're not important, you don't matter. And then the reality is that oftentimes students get into college and they don't really know why they're there, and they incur lots of debt. And then they get out of college and they go back and they work at the mall. I mean, I have a nephew who went to Cal Poly, did all the things he was supposed to do, did internships and things like that. And, now he got his paramedic certificate and he's got a job with the fire department. And the reality is he probably, had he done some career exploration, realized he probably didn't need to go to a 4-year university. He could have gone and gotten that paramedic certificate. And then what he wants to do is search and rescue. So I feel like we're doing a disservice to students if we don't spend more time helping them explore what their interests are, what their skill set is, and have a plan. And it doesn't mean that eventually they won't go to college or go to post-secondary education. But if all they're learning, if we take kids on a tour of UC Berkeley when they're in elementary school, we take them again when they're in middle school, and we take them again in high school. And the reality is UC Berkeley is so out of reach for so many of the students financially and just academically. The percentage of students that they take is so small that, but they come to think that that's the end all be all, and they're not really, prepared to think about why they're going to college and what they want to get out of it. So I feel like when we talk about college and career readiness, to me, it's like we're helping kids understand what they like, what their interests are, what their skill set is, what careers are tied to that, and then what's the path to get into those careers. Because even a kid that is, I'm going to a 4-year university, if they have a better sense of what they want to do, they'll do better in that 4-year university because it will be more relevant to them. Teaching at Mount Diablo High School, we had so many students who, after their first or second year, came back and said, I'm not going to keep going. I'm going to go back to DVC and take classes there because it's cheap, and I don't know what I want to do. And I think for me, coming from the background I had, where college was all we ever talked about, it didn't even enter my mind that I couldn't go to college, that I wouldn't go to college. When I started teaching at Mount Diablo High School, I approached my teaching and my kind of counseling of my 11th and 12th graders that I taught with that mindset, and I realized very quickly that I'm doing a disservice to the kids. That they're not coming from a background like I had, where education was the main goal. It was more got to get a career and got to make a lot of money. And so and there's ways that kids can make a lot of money without going to college if they don't want to go to college, but we haven't given them that pathway.
There's ways kids can be educated without going to college.
Exactly. So the emphasis that I try and do now, and when I'm talking about it, is post-secondary education or training. Like they're going to have to do something, right? Like you can't just graduate from high school and think that you're going to go in and make a living wage in a high demand industry. You might go and get a job being a waitress or working in retail, but that's not gonna that'll seem like a lot of money when you're 18 years old and you just graduated from high school, but in 5-10 years that's not going to be a lot of money, and you'll hit a ceiling very quickly. So the way that we approach it through the program that I oversee is that it's post-secondary education and training, so that they understand that if they go, like, let's say I do want to get into hospitality, well, I'm going to go to Cal State East Bay because they have a hospitality certificate program there. And that's going to connect me to, hotels and restaurants in the industry. And maybe I'll start out as a server, but once I get that certificate, I'm going to be able to move it up into management. And that's how we get students who perhaps don't want to go on to a 4-year university. We get them into livable wages in our region.
So I real quick, I've heard you mention your school district and your school a few times. Can you explain a little bit about the demographics and the student population that you have experience with and who you serve? Are they underserved? Are they marginalized? Are they affluent? Can you tell us a little bit about your population?
Sure. So Mount Diablo Unified is actually, it's an interesting school district because it really does kind of represent Contra Costa County and the diversity that exists within Contra Costa County. We have one high school, Northgate High School, that's in Walnut Creek, and that serves a fairly affluent population. They are, they're, in most cases, not all, but in most cases, they come from families where the parents went to college, 2-income families. So, the conversation at that high school is often about how many AP classes can I take, how many college classes can I take, how can I get my GPA up to a 4.5 or above. Those are the conversations at that school. And then on the other end of the spectrum, we've got the high school where I taught at, Mount Diablo High School, that serves students from Bay Point, which is out near Pittsburgh, and then the Monument Corridor in Concord and downtown Concord area. And so it's a much more diverse student population. It's got the highest number of language learners in the district, the highest number of special ed students in the district, and the highest number of low-income students. So a traditionally underserved student population. But I caution, or I'm hesitant to use the word underserved just because they get so many resources because of their student population, like their Title I school, so they get additional funds. But as I think what we're going to get into later on, the things that are happening outside of the school impact their ability to do well in school. So whether it's the, not having a stable home, perhaps, couch surfing, or not having access to a reliable, food source or things like that. So that's what really makes the education for those students so much more difficult than, say, the students at Northgate. And I try not to presume that all students from Northgate all have it, one way, and all students from Mount Diablo High School have it one way. But just if we were to look at the statistical data of the schools, the students from Northgate are their college going rate is significantly higher than the college going rate for Mount Diablo High School. And so that kind of shows you the two ends of the spectrum that we are serving.
There seems to be a lot of diversity, and it seems kind of be a rather broad spectrum, but am I correct in perhaps assuming that the goal of your program, that is who it serves and the kind of impact you're aiming for, goes beyond grades? Things like confidence, time management, perhaps even knowing how to ask for help, those are universal regardless of what school you're in?
Yeah, so we have, part of the program that we've developed is kind of what we call work readiness workshops. And that's kind of what you're talking about. We look at those as those transferable skills that they're going to need regardless of what profession they go into. And so it covers things like stress management, time management, financial literacy, career exploration, working in a diverse workplace, dealing with your boss, things like that. So we do use that to support kind of the work that we're doing. We make those available to all the teachers in our program, all the CTE teachers, and then we run after school workshops at Mount Diablo High School and Ignacio, our two lower performing high schools, as well as one of our alt ed sites, Olympic High School. Excuse me.
So then let's kind of transition a bit then into education as a social determinant of health. And when I say social determinant of health, I mean things that are non-medical. Your parents' level of education, the zip code that you live in, your income, and of course, like I just mentioned, education. Because education isn't necessarily just about jobs, but it's also about life expectancy.
Right.
And research will show that men with a bachelor's degree will live about 9 years longer than those with a high school diploma. That's almost a decade of life. So my question to you is, how do you interpret a statistic like this in the context of your work? And do you see education as sort of a form of health intervention in its own right?
I do. I see, so when you look at statistics like that, right, kind of what I think about in my role is what that means to me is like a man without a high school diploma is more likely going to do manual labor, which is going to lead to more health problems. They're going to have less access to healthy food choices. And that in turn is going to lead to more kind of health problems, high blood pressure, potentially diabetes, and things like that. So I see education as a form of health intervention in terms of, again, helping students understand that there are pathways to get to jobs that will pay a good wage, that don't necessarily require a college education. So for example, in the area in which we live, we've got the refineries out by, we have Chevron, Shell, Marathon, right? So we've got these refineries and they pay a good wage, and all it takes is a certificate from the program at Los Medanos, the process technology program. But kids don't know about that, right? And so, and you can go into the trades and you're going to be making, $150,000 at a pretty young age with, a little bit of training. You get some college credit for the classes that you take, and you'll be able to move up the ladder so you can move from the more manual labor to management. So I think that's that's kind of what I see as that's my vision for my program is I want every student to graduate from high school with like a 10-year plan. And it doesn't mean, and this is what I have to say to my students, it doesn't mean that this is it, like this is the route you're going to follow, but it's at least get you started moving in a direction as opposed to going, a lot of kids, like when I was teaching at Mount Diablo High School, I would talk to kids and I'd say, well, what are you going to do after you graduate? Well, I'm going to go work for my uncle. He does construction. And I'd say, well, have you looked into like the carpenters union or the building, any of the building trades? Oh no, I'm just going to go work for my uncle. Well, that is where that's going to happen, right? A kid is, because they're not with like a trade union, more likely than not, they're going to struggle with higher health problems because they're doing more manual labor. They're not making as good a wages. They don't have access to health care. And so it just kind of builds on itself. So the better job that we do in helping kids find a direction after they graduate from high school and understand, yes, you can still do construction work, but if you go and follow this path, this is going to lead to higher wages, health care, all that kind of stuff. It's just very hard to teach a teenager why those things are important.
Sure. So if I was to kind of put this in sort of a simple theme, your answer right there, it sounds like education, or I'm sorry, income drives access, and education sort of drives this income. Higher education attainment means higher income, and with that comes better access to healthcare, nutritious foods, safer housing, all of which are directly tied to health. So when you're helping students navigate post-secondary planning, do you think about their future income and by extension their future health and how it is being shaped in those moments?
I think my focus is not so much on their income. It's more about happy. I want them to be happy with where they are in life. And I guess indirectly I'm thinking about health, mental health, physical health, because all of that seems to me tied. If you're in a job that you like and you feel successful in that job, then you tend to be a happier person. So, but just really wanting students to understand how to get from point A to point B, even if you have to take detours along the way.
So mental health and readiness go hand in hand.
I think so, yeah.
A sense of purpose, a sense of direction can buffer against anxiety and hopelessness.
Yeah, so we see, like, if you ever talk to like 12th graders in like March or April, their anxiety levels are so high, right? Because the end of the structured world in which they have lived is coming very quickly. And for those students who feel a little lost, a little misdirected, unguided, their anxiety is much higher than students who are like, I've got a plan. I'm going to, whether it be I'm going to go into the military, or I'm going to go into this trade union, or I'm going to go, even a kid who's just knows he's got a job lined up has less anxiety than a kid who is just kind of floating towards graduation. And the problem that I have is that most kids are, they're like, well, I got to go to college, so I'm going to go to community college. And they get to community college, and the problem is that there is less, I don't want to say support, but less structure for them. And oftentimes they'll go in and they'll meet with a counselor, and they're going to pick their classes, and they'll talk to their counselor. Well, yeah, so I want to transfer. I'm going to transfer to Berkeley. And so the counselor is going to take that, and they're going to pick courses for this kid. And maybe this kid wasn't the best student and didn't really like school, but now all of a sudden they're in college classes that are exactly like the classes they just took in high school. They're taking a math, they're taking an English, they're taking maybe a social studies class. And the kid knows what they're supposed to say, and so that's what they say, but they don't know why they're saying it. Does that make sense?
Yeah, absolutely.
And so what happens then is they get into these classes, and they're like, and they don't do well. And it's very easy to fall through the cracks in the community college system. I mean, that's one thing with my own son. When he was trying to decide, he really wanted to go to UC Santa Barbara, but he didn't have the grades for it. So he was like, well, I want to go to the Santa Barbara Community College. And I'm like, no, I'm not sending you down to Santa Barbara just to party and go to community college. If you're going to go to community college, you'll stay here and go to DVC, because that way, I can make sure that you're on track. Because there's no one, at the community college level, you're not with a group of students who are all on the same path, right? You've got 30,000 students at the community college level, and they're all at different points in their life. And some are dabbling in college, some are very directed, some are coming back in from being out. Whereas at a 4-year, you're with a cohort of freshmen that are all pretty much moving in the same direction. So community college can be a really difficult time for students, and the community college is working on this. Like we collaborate quite a bit on the structures and programs to, like DVC has a great first year program They've got great like Puente for Latinx students, or um, what's the one, Emoja for African American students. They've got these great programs to help keep kids together in a cohort. But for a kid that's just kind of floating through, oftentimes they'll drop out. It takes too long for them to get to where they want to go, and so they drop out.
So, in thinking a little bit beyond graduation, then, in that loss of structure into a new world and sort of post graduation, I want to think about how this could apply to management of their health in the long term, and that is, it seems as though people with more education tend to be more health literate. They're better
Yes.
equipped to understand medical instructions. They're going to ask questions. They may even advocate for themselves in healthcare settings a little bit more. So, how do you see the role of this career pathway and readiness, especially 6 through 12 and early college exposure, in building the skills towards managing their health in the long term?
Well, I think well, one, education, I see as kind of a key role in education is teaching students to be critical thinkers and to question and to be able to, take positions and be able to defend those positions in a way, right? So critically thinking, problem solving. And so I think that that as a primary role of education, that naturally leads itself into someone who's going to be able to manage their health care in a way that students who lack those skills. And then I just think that as you move into professions and you get health care, right? Like that's something that when the current debate over the current legislation that's in Congress about and the Republicans are defending it, saying that it's gonna people will go out and get jobs which are going to lead to health care, ignoring the fact that many like minimum wage jobs, they're not getting health care, right? You have to be at a certain level of employment to get health care. But so that's why if education is helping students get to that type of job where they have access to health care, then they go to the doctor more regularly, then they get those wellness checks, then they have access to medications or to follow-ups and all the things, because the healthcare system is helping them to manage their health. But what happens with many low-income people, right, is they use our hospital emergency rooms as their healthcare, and the emergency rooms or urgent care centers, they're not set up to help you manage your health care, right? And so there's no one that's going to follow up with you when you go to an emergency room, because you have a chest cold. There's no one's going to follow up with you or refer you to a pulmonologist so that they can check your lungs or what have you. So I think that as we prepare students and we prepare them to enter into careers as opposed to jobs, that leads to more access to healthcare, and then that leads to, in my mind, the ability to better manage their own health.
We often think of education as an individual achievement, but I think it can have generational effects. Parents,
Huge, yeah.
as you mentioned earlier, parents' education levels are one of the strongest predictors of a child's health. Have you seen how one student's educational progress can impact their family's trajectory, whether it's emotionally or economically, or even just in terms of how families have access to health services?
So do you mean like if one student who does really well, is that impacting his family's health?
Or is there a difference between students that come from a two-parent home with two incomes and two college-educated parents, or career-minded and career-driven parents versus one or versus none?
Yeah, so I mean, there's definitely a difference in students that come from more affluent, more two-parent income households versus the instability that exists. I mean, poverty has such a huge impact, and I think we oftentimes overlook it as a society. We think too much that, especially when we focus on, say, one student, right? Oh, look, this student was able to get to Berkeley. This student was able to, went to law school, right? But when we do that, it allows us to ignore the 95 other students who didn't get there. And it also gets us off the hook, because we can say, well, if this kid can do it, why can't these kids do it? And they just need to work harder. But poverty is so insidious to a family and a student. Like, sometimes I interviewed a student, and the mom was clearly, high on drugs during when we were going through the enrollment process at the school, and the kid was the caretaker for the mom. Or we have situations where the kids, they have to leave school because they have to go home and take care of their siblings because their parents are working. And that means they can't participate in any of the after school stuff. So a lot of the dual enrollment classes that we're building with DVC are after school. So those kids can't stay and do it. They have to go home and help take care of their siblings. Or, their parents are working at night. So they're at home at night with their siblings. When are they getting their homework done? Right? So it's like this domino effect. And I think oftentimes we just ignore it. We pretend like, if a kid has got the will, the whole Horatio Alger, pull a kid up by his bootstraps, and we ignore the systemic impact it has, and generations, right? Generational wealth, the impact that generational wealth can have, versus not having access to generational wealth, having college educated parents who recognize the importance of school. And it's not to say that parents from low-income families don't value school, but when you're struggling to survive, that's your primary goal, right? And so if a kid can't make it to school because his sibling is sick and mom has to go to work, then that's what happens.
Is the cost of college and tuition becoming to where almost college is now a privilege?
Most definitely. I had a student in our College Now program who got into Berkeley. Yay! So it's huge, lifetime goal. Well, he didn't go. He's not going. He's going to stay here at DVC, which is a totally legitimate choice, right? But because he didn't qualify for enough financial aid to allow him to go to UC Berkeley, and to me that's just a crime. That makes me sick to my stomach. That we have a student from an underserved background, historically underrepresented in our college system, and he gets into Berkeley, but he can't go. And he'll be here at DVC and he'll do great, and he'll get the free 2 years of tuition, and then he'll hopefully be able to go to whether it be Berkeley or whatever other school he decides to go to. But I think, my daughter's going through the college process now. Like, we're just starting that college search. And we're going and meeting up with some of these private schools because she's interested in playing college lacrosse. And we sit down with them and we say, well, we can't afford to go here. This is way out of our price range. And they're like, we'll work with you. Well, you tell us what you can afford and we will do what we can to bring it down to that. But, for a kid like this kid, he can't have that conversation with Berkeley because Berkeley's a giant bureaucracy. Their state school. So no one's going to cut it down for him, right? So that it infuriates me. I think the community college system is doing great with the 2 free years, and that is a huge bargain. But then the question is, where do kids go from there? And are we preparing them? And do they understand, like, okay, there's scholarships, there's grants, are we having enough of those conversations? Like, a kid has no problem taking out a loan to buy a car. But when it comes to taking out a loan to go to college, they're like, oh, no, I'm not going to do that, right? And so those are conversations. We just need to be continuously having them with kids.
So, you mentioned this student sort of underrepresented and underserved. And I would like to say that inequities in education will mirror inequities in health. And by that, I mean neighborhoods which are underfunded, or at least with schools that are underfunded, tend to overlap with communities that face the highest health burdens. Whether it's, like you mentioned, the refineries contributing to air, which leads to asthma, or food insecurity, or the lack of access to follow-up care for a chest cold or primary care physician. So my question would be, from your perspective as an educator and a counselor, how do you think systemic disparities in education contribute to broader health inequities?
Well, I think that when we look at schools that have more low income students, they're they're harder to teach at, because you've got more behavior problems, and then you've got parents that are non-responsive. And again, it's not because they don't care, it's because they're working two jobs. We have more drug and alcohol abuse problems in schools like that. And so they tend to get teachers who are less prepared. I mean, they got me, right? I mean, I was non-credentialed, had never stepped foot in a classroom besides as a student when I started teaching at Mount Diablo High School. I mean, I think it worked out for them, but it just as well could have not worked out for them. I remember having a conversation with the vice principal. He was on his way to interview for our math position, and I said, "Oh, I hope you get a good one." He goes, "We just need someone in the classroom because school is starting in 2 days, and we didn't have enough math teachers."
So when you say schools that are in those neighborhoods are harder to teach at, that sort of has downstream effects of we're not delivering the proper levels of confidence building that we were discussing that go beyond graduation, or the time management skills, or the literacy skills for self-advocation or understanding direction. So there's this downstream effect that stems from just poor delivery of education to begin with that doesn't make it to the endpoint that is the goal of our program.
Right. So, I mean, like I said before, though, a school like Mount Diablo High School gets much more funding from the state than, say, Northgate High School. But where Northgate makes up for it, right, is they've got parents. Like, it kind of makes me sick to drive by Las Lomas and see their goal funding sign with the thermometer, and they're trying to raise $1.4 million to support the programs that WCEF supports. And then you drive by, a school, say, like I drove by one in Martinez, an elementary school, and they're saying they're looking for $45,000. And so, Las Lomas has been able to provide a tremendous amount of resources. Like, they have a 7-period day versus the traditional 6-period day. That means that a child at Las Lomas has the opportunity to take more AP classes. They have an opportunity to take more, art classes, more music classes than a kid in our district, because we only have 6-period days. And that is partially funded by the parent organization. They just had a measure that was on the ballot in May, and it failed. So the superintendent, Akalani's union, sends out an email to all the parents, and essentially it says, "Be prepared for cuts because you guys didn't vote for this. So now we're going to have to cut. We'll cut electives. We'll cut AP courses or what have you." So that's what, like, a school like Northgate has. They don't get as much in state funds, but that's where the parents' role in education continues to create the inequity. Because when Prop 13 was passed, the intent of it was to provide equal funding across school districts. And so that's pretty much what it does. And then you've got some federal funds that kick in to support the Title I that supports the our low-income students and language learners. But the parents stepped in to buoy up the rest of the schools. So that's where that just continues.
So if we accept that education protects health, then access to sort of high-quality schooling, high-quality education becomes a public health issue.
Yes.
And not just an academic one.
Yes.
What would it look like then if health systems and education systems were more, they work more closely together to support students? What's missing in the way that we currently don't have to sort of bridge those two worlds?
I think more needs to happen to support parents in being involved in their schools, because to me that is a huge piece that is missing, and it's not about like just the financial support, but it's like being a part, understanding what's happening at the school, and being able to support their student at home. So whether that means, there's a space for the student to do homework, or, being able to provide healthy food to your children, because if they come to school hungry, right? I mean, definitely the universal lunch, breakfast and lunch that we've had since the pandemic has helped with that. But, what happens over the summer when they go home? And one of the most powerful things one of my principals did for one of our professional development days is she put us on buses and she took us around the neighborhood in Bay Point. And the point of it was to say, okay, this is the route that your student is taking to get to our school, and this is how long it takes your student to get to our school. But as you're going around, it's like there's no grocery stores, there's no Safeway, there's no Winco, there's convenience stores, and there's fast food restaurants. So I think that it's bridging the home and the school. That's what I think has to happen. How do we do that? I have no idea. We work closely with county health. They provide a lot of services. Like right now, we've got students that are getting ready to go into an internship to do work with them. But I don't know how you tackle that bridge between home and school.
So, kind of a magical question here. If you could wave a wand and redesign how schools approach, whether it's career preparation, pathways, or college readiness, can you think of anything that you would want to change or would change?
I think schools have to be the kind of the center of a community, right? And the problem with, like for example, Mount Diablo High School, the kids have to literally like go over a mountain or a hillside to get to high school. They used to have their own high school out. It was called Pacifica High School, and then in the effort to desegregate schools, they closed Pacifica High School and started busing the kids into Mount Diablo High School. Now Pacifica is one of the middle schools out there. But the more we can move our schools closer to the communities that they serve and make the school kind of a community hub, I think to me that could help address some of the problems, because then we can work with public health on providing services through the school. Like, I don't know if you remember, but I remember, I would get, they'd come in and do free dental, work on us when we were kids. Like, you chew the pink tablets and they'd tell you need to do a better job brushing your teeth, so they'd come in and do the scoliosis checks on the girls and stuff like that. So the more we can bring services to the community, so the schools really should be in the community that they serve as much as possible.
You've come to this career, this position, through a couple of different pathways. I'm hoping you can sort of answer my last two questions here with that in mind, and that is, what have you learned and what do you look forward to?
So I learned that every path is an opportunity. So, and this is one thing I tell the kids is don't, like we had a student who her whole life, Berkeley, and she graduated from high school with her AA degree, but she didn't get into Berkeley. And so she was like, I don't know what I'm going to do. I said, this is an opportunity for you to kind of really sit down and think about what you want to do. So I like to say that it's not a straight path. And anyone who stays in a job that they don't like, you're taking years off your life, right? Like, 'cause you spend more time in your job than you do with your husband or wife or child or loved one, whatever. And to do something that you don't like to do is, I was miserable as a lawyer. I can't even, sit there and look at the clock and I can't imagine spending my life doing that. So that to me is like so important that our kids find things that they like doing, because if you like doing it, then you build that passion and that, and then you want to learn more, and then you want to improve things and you want to make things better. So that to me is like one thing I've learned. And then what was the second question?
What do you look forward to?
Well, I am close to retirement. So as much as I love my job, there's a part of me that doesn't want to work as hard as I'm working. My husband could attest to that I work too much. He gets mad at me all the time. So I am looking forward to not working as hard, although I don't ever see myself not being involved. Like I love working with kids, I think, and I love high school age kids in particular. It's like they're on the brink of figuring out who they are. And just being there and listening to them means so much to them. So I kind of look forward to not working as hard and finding a way to stay involved in doing the work that I'm doing. So I guess I kind of envision that I'll probably work for some sort of nonprofit when I get out, consulting or doing something that is continuing the work, because I really, I was not a CTE teacher, but now I oversee all of our CTE programs because I believe passionately that we have an obligation to prepare students to go out and pursue whatever it is they want to pursue, whether that be, a job, a career, college, post-secondary training, whatever it be, but they need to be prepared for it. And I just feel like we've not done a good job with that.
Every day, students walk into classrooms carrying more than just backpacks. Some carry the weight of poverty. 1 in 6 children in the U.S. lives below the poverty line. For Black and Latino children, it's nearly 1 in 4. Others carry trauma, often invisible, but always heavy. Abuse, neglect, addiction, violence. Over 60% of adults report at least one adverse childhood experience. And yet, our systems often expect students to behave, learn, and succeed, as if those burdens don't exist. We focus on test scores, but ignore survival stories. We can't fix what we refuse to see, so we have to ask, what happens when we ignore the impact of poverty and childhood trauma on students?
Kind of going back to what I was talking about, like we ignore the role that poverty has on education, and we ignore, the continued kind of systemic inequalities that exist in education. We want to sweep them under the rug, but if we don't address them, they just are going to continue, whether it be through the type of curriculum that we offer, not serving the students in front of us, and things like that. I think stop ignoring those issues.
Financial insecurity brings with it a tremendous amount of stress, and
Yeah.
growing up in financial insecurity brings with it a lot of trauma that you carry from childhood into your adulthood. And as we know, and are continuing to learn and become aware of, childhood trauma and childhood wounds that you carry with you can be detrimental for the rest of your life, whether it's in your career or with the relationships that you make as an adult. So
Yeah, I think we are oftentimes we're like, well, just grow up,
Right. Rub
be
some dirt
different.
on
Be
it.
different. And it's like, well, I can't. That's who I am. It's how I was raised. It's in my roots.
Thank you for your time. I very much appreciate taking time out to answer these questions.
Of course.
And I look forward to speaking more with you in the future, whether it's through a situation just like this or out and about when we run into each other.
Yeah, definitely. Thanks for talking to me, John. I appreciate it.